Hello, viewers. I welcome you to today's edition of our program, The Health Center with Ozion at Kumye. This is your regular host and anchor, Ozion the Expressionist, speaking to you here on the topic calcium and vitamin D. Yes, because it's important that we know the function of this mineral called calcium. So many people take the vitamin supplements, vitamin D, and the calcitriol or calcitriol. Or some people equally take the calcium. But here, you will get the best of why this is important and what it causes when it is in excess or low. So, the vitamin D is where we start from. Vitamin D is gotten from the sun. We have two types of vitamin D that we have in our body. We have vitamin D2 and we have the vitamin D3. Vitamin D2 is rarely gotten because it comes from the transition from the sun rays to mushroom and it's very rare. As well as from fishes. Only fishes with the oily fishes like salmon and some other oily fishes. So you see, those areas you will hardly find people deriving the vitamin D, which is D2 in their body. So the popular one is vitamin D3, which comes from the sun directly to our skin. It's onto our skin that it is synthesized and comes into our body. But vitamin D3 is very inert, or I would say inactive. So to get this into our body and to function in a very active way, it goes through some processes. But let me state quickly that people like us, the black people, have this barrier of absorption of vitamin D3 from the sun. Not that they do not absorb, but from study, they can only absorb not more than 15% of the amount of vitamin D3 that is required for them. So, where do they get the rest? It means that they have to get the rest from some other place, and the rest of the place is from supplements. Yes, basically supplement. So people have known this and they take supplements so much that they even take it in excess that their body cannot regulate. Because there are three regulators that has to do this. The three regulators are what you call the calcitriol. The calcitriol is the active form of vitamin D3. We have the PTH, which is the parathyroid hormone, which comes from behind this thyroid, which is a butterfly-shaped gland. Behind it, you have the four parathyroid glands, which are there to stimulate the hormone that helps in increasing the calcium intake into the bloodstream. Then we have the calcitonin, which is the anti-parathyroid to certain level because it inhibits, blocks, regulates the level of the calcium in our blood to ensure that it doesn't go in excess. Because when you are measuring the calcium level of someone, it is the level that is in the blood that is being measured, and that's why it is called hypercalcemia. Emia has to do with blood, and the hyper is the high. Cal means the calcium. Now you get it? Let's go. Now, with these three regulators, we'll now understand what happens. That when this skin gets the inert vitamin D3, it brings it down to our intestines where the job begins. The job of activating the vitamin D3 to calcitriol. And that is where it is turned to calcitriol by the process called hydroxylation. The hydroxylation continues to the kidney, which plays a major role in calcium absorption in our body. And when it reaches the kidney, it now completes the process of hydroxylation, and we have that calcitriol. The calcitriol, which is the active vitamin D, is what helps in absorption of this calcium in our bones and our intestines. How do we absorb the calcium? We absorb it from the food we eat because calcium is gotten from the food we eat. The calcium from the food we eat, certain foods, like what? Orange we take is calcium. We get it, orange. Yeah, we get calcium from orange we take. And so many other foods that has calcium. Milk as well. And the list that you see here are many others. So this calcium now transits, moves again from the bones by the help of the thyroid, parathyroid hormone, which pulls it from the bones and the intestine again to the bloodstream. That's what helps it. When it goes to the bloodstream, the level increases, and when the level is about to go beyond its normal level of 911, the calcitonin strikes and pulls it. Where does the calcitonin come? It comes from where we call the parafollicular cells in the thyroid gland. The parafollicular cells allows the calcitonin again to purge out and reduce the level of the calcium in our blood and maintains stability. So with this, if this is not really regulated very well, maybe you have a problem in your parathyroid gland. For instance, those who have adenoma, a tumor there, they have a high release of the pituitary parathyroid hormone. And when this is highly released, it means that they will have increased calcium in their blood. And that is hypercalcemia. What happens to these people? They will have symptoms such as muscle twitching, muscle cramps, agitations, restlessness, pains around their body, any kind of pain that will be making you feel like something dangerous happening to you. It might last as long as that calcium is not reduced. Headache, even forgetfulness, and so, nausea and vomiting, and other symptoms as shown here on the screen. If it happens that the calcium is lower, then the person will suffer certain things like numbness, or called paresthesia, weakness as well, and the symptoms you see here. So with these, what happens in this person that is having a high level of calcium in the body? The symptoms has been stated, and they could as well be someone who is aging, because the level of these all hormones are not as much as it were when younger, as well as someone who in the female folks from 50 years whose estrogen has lowered and the production of the calcium is lowered. So the pituitary tries to absorb more of the ones in the bones and the intestines whenever it finds calcium. So the regulation is not there anymore. So because the person is aging and the estrogen is there and the pituitary hormone, the parathyroid hormone absorbs so much into the blood, the calcitonin is equally not getting the level of balance that it needs, because everything now, because it cannot, the person, most often sometimes these people take their vitamin D and as well as calcium, and the regulation is not as it should be. So the level in the blood is high. So there is imbalance. Some other thing could be that you have a low bile acid, which should be formed from your cholesterol in the gallbladder, which helps in dissolving the fats in your body. So if that low bile acid is there, you will not be able to dissolve the fat soluble vitamins, and the person will be having, which means there is no vitamin D. The vitamin D that helps in the absorption of there is high vitamin D, and the absorption of calcium is high, and that is the problem now in the person having hypercalcemia. So with this, the problem of hypercalcemia persists, and it is very, very pertinent to know that calcium helps in blood clotting, and when this increases, what happens to the person? The increase in clotting of the blood could begin to tend towards thrombosis. So there are so many dangers to allowing this calcium increase in your body. And then the other side of it, I have mentioned, what is called a causes. So a balance of this is very important in our body, so that one will be able to know that at this level. And how do you find the level? You have to do your BMP, basic metabolic panel, or the CMBP, which is the complete metabolic panel, to find out the level of your calcium in your body. 9-11 will help you to know that at 9, between 9 and 11, anything that's going towards or exceeds that is either very low or exceeds or below. So it is important for us to know this and to know the symptoms, so that we do not go to looking for a problem where it is not. The calcification of calcium exists when this calcium has increased, and one could begin to suffer bronchospasm that makes you feel that you are suffering from asthma, as well as the kind of things that might be arterial calcification that makes you feel like you're suffering from cancer of the skin. For cancer of the skin to be there, remember, I will let you know right now. ABCDE, asymmetry, border, diameter, evolution, color as well, has to be there to be sure that this has to be cancer. If not, and it is at this time, such kind of calcification in the artery will be painful. You're suffering from. Check. You go and check your calcium level before you confirm. So these are the things. Twitching as well, like I mentioned before. That's why we need to check these things and then know what we are treating. So that when you are equally taking the vitamin D supplement, which has a certain level depending on your age, if you check the international unit, there is what you call the recommended dosage allowance. For children, 700, 1 to 4, and then the categories are there, as you can see on the screen. So this will help you to know what you need to take at a certain time. Vitamin D3 at what level, or this, or that. There are other signs, there are other symptoms, but I will leave you at that, as you can see on the screen, because we don't want to leave you to search for information too much out there when Kunye can give you the rest. For the love of you and health, which is wealth, I leave you with this information to go ye and enjoy your life. Remember, we do not prescribe. I do not prescribe any medication for you. I only will tell you what to do to keep fit and live better. Thank you for listening to us today. I remain your host and anchor of this program, Ozion the Expressionist. And remember, health is wealth. Thank you.